So with that, I will transition to session one, which is going to be provided by Dr. Christina Arnold, and the session is entitled An Overview of Pathology. So Dr. Christina Arnold is an associate professor in the Digestive Disease Service in the Department of Pathology at the University of Colorado Anschutz campus in Denver. She has co-authored 2 textbooks and is a series editor to an Atlas-based surgical pathology textbook series. Dr. Arnold serves on the Curriculum Education Committee for the College of American Pathologists, is an editor for the American Journal of Surgical Pathology and Archives of Pathology and Laboratory Medicine, and served as vice chair and chair for the Roger C. Haggett Gastrointestinal Pathology Society. She has received a number of teaching and career development awards, including the 2020 CAP Distinguished Service Award in recognition for her work on the CAP's virtual lecture series during the COVID-19 pandemic. Top 5 of pathology professionals under the age of 40 by the American Society for Clinical Pathology, and 3 times featured on the Power List for the top 100 pathologists worldwide by Pathologist magazine. She publishes and lectures nationally and internationally on trending topics in GI pathology, social media, and wellness. So with that, I will hand it over to Dr. Christina Arnold. Thank you so much for joining us this morning.
Good morning. Can you hear me?
Yes, loud and clear.
Okay, good. So I'm sharing my screen and let's see. Do you see my screen, Pathology Urban Legends?
Yes, we do.
Okay, fantastic. All right, let's see. I guess my Zoom screen looks a little funny. While we're doing this, I always like to ask who is in the audience. So could I have in the chat box, you guys let me know M1, M2, thinking about med school, etc., just so I know who I can gear this talk to while I'm trying to figure out this Zoom window, which is a little bit funky from my point of view. But if you can see me, we're good. Okay, so got some chat box going. All right, so my name is Christine Arnold. Thank you, by the way, Lauren, for that introduction. It's been really wonderful working with you. I've been so impressed by your organization and all the good that you guys are doing. And also Dr. Kamran Mirza, who is just a force of nature and is an inspiration to us all. It's really nice to be here with all of you. And whoever you are out there, I wish we could be in the same room. It would be really wonderful. But I wanted to take a minute just to say, to those of you who are in medical school now, who are thinking about medical school, I just salute you because 20 years ago, I went to medical school and it was hard. Going through medical school in the pandemic, I can't imagine how difficult that must be. And I hope you never lose sight of what important work that you're doing. We're going to look back in history at this time and what were we doing? And some of us will be surviving, and that's okay if that's all we're doing. But you guys are going to be the ones who are becoming doctors in the middle of the pandemic. In the midst of this kind of broken world, broken healthcare system, you are going to be the healers of it and the leaders of us all. So if you ever are, I know I was just teaching our med school students, and I could tell that they were dialing into the session from their bedrooms. And, that's not how we did it 20 years ago, but it's how it's being done now. And I just reached out to let them know that if you ever feel unsure of yourself right now, know that you're making history and this is what it feels like to make history. So thank you for being here today. Thank you for doing exactly what you're doing. And I can't wait for you to join the ranks of a medical doctor soon. Maybe some of you will do pathology. That would be amazing. But we all are on our own path, just like Dr. Sitar said. Everyone's on their own path. I have on my title screen my Twitter handle, my email. So if at any point you feel like you want to reach out or share your story or there's something I can do for you, don't hesitate. And yeah, Pathology Urban Legends. I'm going to tell you a little bit about my view of pathology, my worldview. Okay, let's see. So this is, before I tell you a little bit about pathology, let me tell you a couple of other things. So I just moved to Colorado, and this is on my birthday hike up to about 12,000 feet above sea level. This is Blue Lake. It was kind of my dream to go up here. And I just thought this is such a great image to have as you're talking to medical school students or talking to people who are about to be doctors, that each step along the way, there are a lot of hard steps, but the view is worth it. So now I'm telling you, as an attending, I had 2 babies in medical school. It was really hard. I'm married to a doctor as well. And there were really hard days. Like my hardest days were probably in medical school. And there were days where it just really kicked my butt. I will be honest with you. but it's worth it. So hang in there. You have hard days ahead of you. The life of an attending, whenever you find your lane and you're in your lane and you're able to make a difference and you're able to help patients and you're able to feel like you are making the world a better place by just being in it, it's an amazing feeling. And keep up the good work. This is my family. So, yes, I'm definitely more than just a doctor. And I have a husband and 2 kids. And this is us. We went to Zion. This is a picture of us in Zion a few months ago. And so, for all of you out there who are thinking of having a family, who have aspirations to be more than just a doctor, follow your dreams. We're whole people. We have to do more than just being a doctor to take care of ourselves. It's really important to cultivate your hobbies, your passions, and bring to every part of your life as much as you can in terms of joy. Okay, so that's a little bit about me. Let me dip into my route to pathology. I find that I always thought I was all by myself, but it turns out the more I give this talk, the more I realize a lot of us don't have the straight route to pathology. So maybe this will resonate with you. All right. Here's my nerd coming out. Here's the graph, right? Here comes the nerd with the graph. Here I am. All right. So we have happiness on this axis. And then this is over time. So this is M1 year, my first year of medical school, graduate school, M2, 3, 4, resident fellow attending. We'll just keep it brief like that. I'll say when I started medical school, it it was really kind of exciting because I didn't know what medical school was like, and you just take books, memorize it. You get to spend time with other doctors. That was a really cool feeling. Like I can do this. I can do this medical school. All right. So I had actually signed up for the MD PhD program. So after my first year is this huge dip in happiness because I went to become a graduate student in a lab, and those were my dark years. Sort of, if you recognize Beaker, the Muppets, I grew up on the Muppets. Actually just watched the Muppets last night too. There's Beaker, and then I forgot his name, Professor Cantaloupe or Watermelon or something. And these two are disasters in the lab. So that was my experience. I mean, I think on all metrics, I was doing well, but I hated it. And I think what Dr. Setar is saying, find what your lane is so important. So even though I was doing well in graduate school, I hated it. And I had there's no patient care. Everything was very slow. So for me, graduate school wasn't the thing. I had to realize that I needed to do what I wanted to do and not what I was supposed, what I should do, what I was supposed to do. So I left graduate school, and that was really hard. Went back to medical school, started seeing patients. This is a mission trip to Mexico, and that was really amazing. Along the way, I took a pathology course. By the way, at this time, I thought I was going to be a family doctor. I took a pathology course, and I thought it was really interesting. And my pathology attending said, "You should really think about doing pathology, Christina. You're really good at it." And my response to her, can you believe it? It was, "No thanks, no way. I mean, that's not why I came to medical school. I want to have a stethoscope and a white coat." But she planted a little seed about keeping my mind open. And then I went to third year of medical school, and I realized on the first day that was not for me. Patient care was not for me. I love patients. I'm like one of the most social people you'll ever meet. So it's nothing about people. It's just that because I love people so much, the pressure to turn the room around every 15 minutes instead of having a meaningful conversation, and the pressure to make the money and the pressure to protect myself from lawsuits and all the notes, I was extremely turned off by that. I wanted my idea of the perfect of profession was thinking about disease, talking, not being rushed, not being driven by protecting myself from lawsuits, but being driven by intellectual curiosity and making discoveries. And so on my first day of third year, when I realized I wasn't doing patient care, that didn't leave me a lot of options. That was super scary. So I was between radiology or pathology. I thought those were the only two things. And I'll be quite honest, I do not live in a basement. I cannot be in the dark. So radiology was not going to be, I could not see myself in a dark room. So I took a pathology elective, and my first day on my elective, I knew it was for me. It was so interesting. We were making the diagnoses. The doctors were coming to us for answers. Our patients were the doctors. We were surrounded by people on the same team who all wanted the same thing, which was best patient care. I was no longer dealing with parents who were abusing their kids and having to give them psych meds. I really had trouble with helping people who weren't being good to other people. And that's a crazy thing to, um, if you're going to be a good doctor with patients, you have to be a good doctor to all patients. So I clearly could not do patient care for that reason. All right. So then I did residency at UT Southwestern, fellowship at Hopkins, and now I'm at the University of Colorado. Life is the best it's ever been. I'm so excited. It's all worth it. That's my story. But I almost didn't pick pathology. I almost picked family practice or internal medicine. And it's because I bought into all of these urban legends. And if we were in a room together, I would say, what urban legends have you ever heard? Share them with us. Or you can do that, I guess, in our chat box. So, urban legends are defined as these little bits of stories that travel through society very quickly because they have one grain of truth, but they're wrapped up in all these salacious details. So, I wonder if you guys have heard urban legends before. I'm sure that you have. The most common example, if you were to Google an urban legend, is this. It's that there is this family of alligators in the sewers of New York City that are going to come up and just like take over the city, right? That comes up a lot. Or someone went to a party and woke up in a bathtub full of ice and their kidneys were gone. These are crazy stories. Crocodiles are reptiles. They are not going to live in a sewer. If someone takes both your kidneys, you're not going to wake up from that. So, these are crazy urban legends, and they definitely apply to how medical students pick their career. There's literature out there, and that's what a lot of my talk is based on. When they query medical students, why did you pick pathology? Why didn't you pick pathology? And it turns out a lot of these decisions to not pick pathology are often based on urban legends, that is myths, that is things that aren't quite true. So I want to give you the truth behind all these urban legends and help you make an informed choice, whatever your informed choice is. You guys have probably seen something like this. Colin Lilly posted something really cool yesterday on Twitter of a kind of an updated version of this. This is a model system that if you're just starting out medical school, or maybe you're third year, I was a third year medical student before I made this decision. So you're somewhere thinking about being a doctor. What kind of doctor do you want to be? This is built on lots of urban legends. So let's take a look. Hold on one second. This is built on lots of urban legends, but it still has a little bit of use because some of it's true. So let's say you're a medical student, you're sane, you're hardworking, you have, let's see, we're just going down this flow chart. I hope you can see my mouse. Your attitude is nice. You hate adults, pediatrics is for you. Or let's go this one, you're a sane medical student who's hardworking, maybe not so much hardworking. You don't like the light, then go to radiology. Or let's do pathology now. You're a sane medical student who works very hard. Your attitude doesn't matter because you work with dead patients. Then go to pathology. So there's little bits of truth to these things, but who wants to pick pathology if your attitude doesn't matter and you only work with dead people? So there's a lot of misinformation in these types of flowcharts, but they are a lot of fun to go through, especially if you don't really have an idea of what you want to do. All right, so let's take a look at some urban legends. The first one, the one that now, by the way, I bought into all of these. So I'm just going to rank them in order that turned me off to pathology when I was a student. Pathologists are antisocial. They're just alone with their test tubes and microscopes. They hate people. And the reality is that pathology is very social. If you're not social, you will not do well in pathology. You really do have to be kind, compassionate, interested, and interesting. My patients are other doctors. The doctors come and ask me what to do, and that's amazing. It feels great because we're all on the same team. We all want the same thing, and I love having all this knowledge. I'll be honest with you. It's really cool when you go to a tumor board and the surgeons, these big shot surgeons are guessing at what it looks like, and the radiologists are guessing with what that shadow means. And who comes with the answer? It's the pathologist. Always. It's an amazing feeling. You can do a lot of good for patients. All right, pathology is social. It's just like every other field of medicine. So these are some different teams in pathology. This is Dr. Southern. When I was a medical student, he actually rounded in Parkland. He had a team in internal medicine, and a couple months a year, he saw patients in the ICU, on the floor, in the clinic. That's exceptional, but he's pretty amazing. This is a blood banker who is in a transfusion medic clinic. So when I was in transfusion medicine, we write orders, we listen to heartbeats, we admitted patients, we discharged patients. We had a team of people that included a nurse and a fellow, and we visited patients. That is something you can do day in and day out on blood bank. This is more the kind of team that I work on more. This is a surgical pathology team where I teach people, like this is an attending at the microscope. We teach fellows, the clinicians drop by, medical students, trainees around a microscope and teach them how to make the diagnosis. So very social, very, very, very social. And that fits with my personality well. There are definitely people who are less social than me, by the way. There's room for everyone. Urban legend number 2. Pathologists never see patients. I agree with Dr. Setar here that if your heart bleeds for patients, like you have to touch a patient, you have to hug a patient, you have to talk to families, and that makes you feel fulfilled, then primary care needs you. And I'm not going to make any jokes about it. I don't want to pull someone into pathology who's not meant to be in pathology. So if you need that feeling, this is not for you. But if I would say we do actually see patients, depending on how you look at it. I like to explain that I see the most interesting aspects of every patient in the hospital. They're coming to me. I'm kind of whittling out the ones that aren't as super interesting. But when you think about it, the most interesting patients, what is that mass? What is that tumor? What is this? Why does she have that dysphagia? All of those symptoms, those are diagnosed by the pathologist. That's really interesting, I find. There are fields in pathology where you can see patients on a regular basis, not as much as primary care, but close. And they're listed here: cytopathology, blood bank, dermatopathology, microbiology, perhaps. Let's look at some pictures. So here's our transfusion medicine clinic again. Here's where our patients are hooked up and their blood is taken through this machine that spins out, let's keep it real simple, spins out the bad components, puts the good components back in here. And this is amazing. This can have a really amazing effects on the patients. So if you need to see patients to like writing orders, you want to see them improve before your eyes, this is a really interesting part of pathology. This is from a dermatopathology clinic. So my friend, Dr. Carlo Cavino, he sees patients a couple of days a week. He takes off their skin lesions, processes them in his lab, and then he reads the diagnosis other days in the week. So it's a really balanced way to see patients and have long-term relationships. This is Dr. Southern. He actually has a clinic in South America. So he goes down there a few months of the year and sees patients and helps them, treats them, gives them antibiotics. That's unusual, but that's a really cool story. Okay, so urban legend number 3. By the way, we'll have time for questions, I promise. So write them down if you have them. Urban legend number 3, pathologists are not clinically relevant. This is this statement, it surprises me that people still think that. And you'll hear that and that when you walk down the street and you say, I'm a pathologist, most people are not going to know what that means. They might say, oh, I watch CSI. Oh, yes, I've seen some law show. And that's not exactly what most of us do. I think there are a lot of doctors even who don't recognize what a pathologist does. So this is something that I think is a turnoff for some people where they feel like they're not respected in the field or that people don't understand what they're doing. And that just means we have more work to do to educate everyone. All right, so pathologists are not clinically relevant. That is absolutely not true. So we know that 70% of all diagnoses come from pathology. There's no, I mean, all fields are important, but this one's really important, right? And so this comes from every moment is governed by pathologists from when the patient's born, that placenta goes to pathology. The labs on that baby are sent to pathology. The patient had their whole course of their life, they go see the doctor, those labs are sent to pathology. The patient dies and goes to the morgue. The whole course of the life from birth to death is really a large part governed by pathology and diagnoses coming from pathology. So we provide all these really important studies that help guide therapy and help determine prognosis. And it's very important for patient care. So you can imagine, are there hospitals out there that don't have pathology lab? Not many, if any. Pathology is really, really crucial. Are there hospitals out there that don't treat pediatrics? Yes. Are there hospitals out there that don't treat geriatrics? Yes. Are there hospitals without surgery? Yes. But every hospital has pathology. That's how central pathology is to patient care. So let's look at some ways that pathology is important for patient care. This is a little flow diagram. A patient came into Cytology Clinic. They're actually going to be seen by a cytopathologist. The pathologist says, "What's going on?" He says, "I have this lump right here." The pathologist says, "Okay, well, let's put a needle in it, squeeze out some of the contents, put it on a slide, stain the slides, look at the slides. Within 15 minutes, we can say, hey, that's a pleomorphic adenoma. Fantastic. So we can provide these bedside diagnoses within a few minutes. That's really reassuring and helpful. Here's another, this is what I do. I'm a surgical pathologist. So we'll have a patient who's in the OR under general anesthesia, intubated. They find a mass that they weren't expecting. Let's say the surgeon finds a mass they're not expecting. Or the surgeon, let's say another example. They have a brain tumor. The surgeon gets in there and they need to know if it's a lymphoma, if it's a primary glial or primary brain tumor, if it's a metastasis, because that will direct therapy. So they'll give a little chunk to us. We'll freeze it like a popsicle and cut a little slide of the tissue, stain it, and then look under the microscope. And within 20 minutes or less, we can tell them, hey, it's a lymphoma, stop. Or this is a primary brain tumor, go ahead and finish completing it out. Or this is a metastasis. So that's profound. It's really fun. If you get a chance to do a path elective, consider rotating on the frozen section bench. Nowhere else will you see how important pathology is. That's one of the few places. Really satisfying. Okay, guys. Urban legend number 4, I'm telling you, I related to this. Pathology is like crime scene investigators. You have to love autopsy. You have to be kind of gruesome to be a pathologist. And that's not true. That's not true. Let me tell you this. For my training, I did, and I'll describe what APCP is in a minute. But for my training and residency, I did have to do autopsy. It was 6 months in total. It wasn't all 6 months. It was 3 months of all autopsy, and then I had 3 months of writing the autopsies with other rotations. But a very small part of my training. There are training tracks where you never have to do autopsy. So if it's something you really are not liking, you don't have to do it to become a pathologist. I'll say that autopsy was really hard for me. I will tell you, I cried at every single one of them. I just like really, it was very difficult. They were important, and I see the value of them. The first one, for example, it was a 14-pound baby that was born vaginally, and I mean, right there, you know that's not good. Women are not built to birth that size baby. But the baby was born, and the OBGYN broke her hand delivering the baby because there was so much force to get this baby out, and the neck was broken. And so that was a huge thing. If we hadn't done the autopsy, maybe the mom would have blamed herself for the baby's death. If we hadn't done the autopsy, maybe the OBGYN wouldn't have had the opportunity to realize that this was not the optimal. This terrible outcome could have been prevented through a C-section. And I could give you lots more examples. Whew, just even thinking about it makes me tear up. I give you lots more examples. Autopsies are critical. I am so glad there are people out there who that's their jam. It's a very important part of medicine. It's definitely not for me, though. And it's okay. Most pathologists, so here's your secret, most pathologists don't ever do autopsies. And I've had 2 jobs now. And in my jobs, part of my negotiation is I said, I will never, ever do autopsies. So don't let autopsies turn you off to pathology. That's my message. Keep in mind, pathology is a dynamic field. Check out all these options, folks. Autopsy is only one of them. Look at all these other disciplines you can go into. So don't discount a field based on 1/50th of that field. Okay. Urban legend number 5. I agree with this one too. I had this feeling that I couldn't do pathology because I really get motion sick when I'm in the car. I've got Dramamine in every vehicle I'm in. My travel pack has a pack of Dramamine, not just one, like 12. And I get very motion sick. And looking through the microscope made me sick. So I thought, oh man, I'm not going to be able to do pathology. That's a myth. You can do pathology. And let me tell you why. First of all, there are many fields where you will never use a microscope, just like those blood bankers, right? So you don't have to use a microscope. And second of all, you need to give yourself time. Like it took you a while to learn how to walk. It's going to take you a while to get to learn how to use a microscope for some of you. Keep in mind that the microscopes, if they even have them in medical school anymore, they're not giving you the top line microscopes, right? They're giving you the little baby toy microscopes because they're very expensive. So they're going to give you the not the nicest ones. It's going to be hard to focus, and yeah, it's going to be challenging. But most of you probably don't even have microscopes in medical school anymore. At least that's the case the last few places I've been. And so it might be extra challenging for you when you first sit down because you've never looked through a microscope. But there are a lot of tricks, and they're listed here. It's like a muscle looking at a microscope. If you have problems with it, you start with small intervals and you work up over time. And it's true, after a year, I was fine. I'll tell you, yeah, I'm going to skip the story, but other things that are helpful is to scan up and down. So your brain is used to going left and right or left for reading. So if you scan like left or right, your brain is going to expect that movement in a certain pattern and it's going to make you sick. So instead, trick your brain and go up and down. It'll be much easier. Some places will have a screen on the wall. They'll project the image on a TV. That will be much easier to get used to. So opt for that if you get sick, if you're feeling sick, because you are used to watching TV. So your brain will be used to watching that screen. Take breaks if you can. I usually had like a ginger ale or I had a ginger chew, and fresh air and a walk really helps. But sometimes I'll be honest, you're not going to have that option. For example, I remember when I was a medical student, we would sign out heme path for the 1 week I did heme path, and those were 12-hour days. And you couldn't just say, hey, I need to go have a drink, when your attending is there huffing through, pushing through those 12 hours. And so there's something you can do though. If you're at the microscope, this is a secret. So I'm telling you a secret, but here you go. If you're at the microscope, if you're in the right plane, your eyes are right where the light's coming out, you'll see. But if you move 2 centimeters down, that light will now hit your eyebrow and you won't see it. It'll go dark, but it'll look like you're paying attention. And that might be just what you need to just take a breath, to center yourself, and then get back into sign out. It's not being disingenuous, it's preventing yourself from throwing up. That's how I looked at it. And I didn't want to miss anything. All right, hope that helps. Urban legend number 6, pathologists have to do research. For some people, that's a big turnoff. And I want to say that myth is, let me dispel that myth. If you're an academic pathologist, probably there is some requirement or encouragement or incentive to do research, but not always. I've definitely been at places that don't require anyone to do research. They if you love to teach, go teach, but they don't always pressure you to do research. If you do private practice or community practice, you won't have any requirement to do research. So there are definitely jobs where you don't have to do it if you don't like it. However, I think pathologist is the best field to do research because we have lots of time, lots of material. The resources are really important. So there's a lot of opportunities to do important work. And it's weird. I don't know. I can't figure out quite what it is. Maybe you guys will figure this out. But I feel like in pathology, we are the explorers of the world, which is funny because I have this map behind me. Like we are the last explorers of the world. For example, internal medicine, it's harder for them to invent a disease because they've seen everything. But in pathology, we're still making discoveries all the time. It's incredible. Let me show you one. I'm only going to show you one. For those of you who are not into research, I don't want to bore you too much. But here's one of my papers that I put together. And you don't even have to know where we are, what's going on here. But we identified this pattern of inflammation, all those blue dots, this pattern of inflammation, and we've identified that it was always associated with these little red spirochetes with syphilis. So without even seeing a patient, without even knowing their name, without even looking at their chart, when I see this, I know this person, I can tell you all this from it. They are HIV positive, probably not recognized yet, a man who has sex with men, and they have syphilis and or lymphogranuloma venereum. And I'll tell you, the couple of papers we put out here has been profound. These people, one of them was pending a colon cancer resection. They thought he had colon cancer, this big mass in the colon. So they were going to take him in, take out his colon, and the answer was antibiotics. And so he was cured with antibiotics of the mass. That meant by for us recognizing this, we prevented him from losing part of his organ. We prevented this patient from exposing his unrecognized HIV to everybody else in the OR. We got the patient on heart therapy, at least latest I heard, which might have extended his life. And if he practiced safe sex, maybe we helped decrease HIV. That's amazing. And that's something we could do in pathology pretty easily. This paper took a couple of weeks to put together, and it's amazing the research you can do in pathology. Does this have a real life impact? Absolutely. All these people who are going to get their colon out or who would have been labeled with Crohn's or ulcerative colitis are now being cured. And when I went to Columbus in 2012, there was a syphilis outbreak that was tracked back to 2012. Might that have been from the one pathologist who come to Columbus and started recognizing it and teaching people? Maybe. But yeah, we do a lot of good work in pathology. All right, guys. Urban legend number 7, pathologists have a great lifestyle. This is so true. This is so true. Now, this is, I'm going to show you a few pictures. Of course, the world is very different now because of COVID. But in November was my last international trip before all the world, closed down. And this is Cuba. So pathology is a visa to the world. We travel all over the world because we have time. I'm off every weekend. I'm off all the holidays. I'm off in the evenings. And I worked 1 week in October, 3 weeks off, and not vacation. That was just my academic time. So there's a lot of time to do really important work. So we went to Cuba to teach them about how to recognize syphilis in their patients, for example. Here's my group of girlfriends. We went to Machu Picchu. I look like I'm about to die because this was like a 4-day hike. I think I might have been about to die. But we flew to Argentina, to Peru, to Uruguay, to Ethiopia to teach people about this type of colitis and save patients' lives. So this is Machu Picchu. This is us. We went to Hawaii to teach also. And yes, that was a while ago. But yeah, we went to, the world needs pathologists. The world needs good pathologists. There's a lot of opportunities to travel and teach. This is us in Africa with a monkey on our Jeep. Okay, so for me, what am I doing with all this free time? There's 3 weeks I have off in October. So writing books is something that I'm interested in. So here are 4 the books. I helped write with my colleagues 2 GI books, and then we're building a series that's coming out, and we'll have like 20 books by the end. But that takes a lot of time, and that can be done with all this downtime. But maybe you don't want to write books, but you want to do something else. Maybe it's raising bees or taking care of your pets. So my real free time, what I really care about is spending time with my family. And this is us. And some of you will be offended that our dogs kiss us on the lips. I know, but I can't help it. We're that kind of family. This is us in Telluride. And yes, this is what's really important. I didn't even realize he's wearing a PathSIG t-shirt. Pathology Student Interest Group. Hold on one second. Okay. All right, anyways. I'm emotional when I see my babies. I get emotional. So you'll have time to do lots of things in pathology. So other truisms I want you to keep in mind. It's a relaxing work environment. We don't really have that hierarchy you'll see in other professions, which I thought was nice. I think I remember in OBGYN, like there were certain chairs you could sit in, certain chairs you couldn't sit in. Lots of interesting patients, very intellectually interesting. I think the salaries are good, particularly in private practice, particularly if you look at per hour, if that's a consideration. All right. Usually I stop here and take a few questions. I think we'll have some time at the end because the next segment, it's going to be like a little more granular details about what pathology is. This is a picture of Aspen. All right, so for you guys, let's go. So I hope what we've done, let me go to this picture. I hope what we've done so far, you're intrigued. You're thinking, this could be for me. This sounds so interesting. All right, so hopefully that's where you are. So now let me tell you a few granular details. You're going to hear this a lot as you continue your exploration of pathology. What is anatomic versus clinical pathology? Anatomic is diagnosing tissues. So that's going to be surgical pathology that resect the tumors, cytopathology that are putting needles in masses and making diagnoses, autopsy, forensics. Clinical pathology also makes diagnoses, but these are mainly based on liquids or fluids. So this will be chemistry like drug screening, blood bank, we've shown a few pictures of, microbiology. Hematopathology can be either, depending on where you go. How long is the training? If you do a combined anatomic and clinical pathology, that's 4 years. Now, if you just want to do anatomic or clinical, let's say you don't ever want to do autopsies, so you want to do clinical, that's 3 years. I recommend people just go ahead for the 4 years. For that additional year to get both training, I think it's just worth it. I have known people who did AP only, anatomic only, went into private practice, and then their group said, you need to go back and get a CP license. So they had to go back and do another 3 years. So they did 6 years of training to get what they needed. And when you go back to residency, you get paid as a resident. So that's a huge sacrifice to go back down to that salary. Most of us do at least one fellowship, and most fellowships are a year. I did one fellowship, but it was 2 years. What is the money like? So let me tell you the things you might be afraid of asking, but you probably should know. What is the money like? I think um, it's probably mid-range overall. I'll show you some data. But if you look at it, I always tell people look at it as dollars per hour. Dollars per hour is probably the highest paid, I would guess. This will vary depending on academics versus private. Usually, academics is paid less, but we have a lot more free time, right? The private person is not going to have 3 weeks off in October unless they take vacation. It will vary with subspecialty and geography. So, more advantageous, like more luxury sites, usually pay less. Interesting. The least desirable places usually will pay more, but who cares? It's not a super important factor. Academics are usually around 250. Private practice, those can start around 500 to $1,000. So, this is a lot of money. But I always tell people look at dollars per hour. So, this is a survey of physicians saying who feels like they're being compensated the best. It's dermatology, emergency medicine, and pathology. The plastic surgery might bring in the most hours and most dollars per year, but in terms of hours they're working, it's they don't feel like they're fairly compensated. And our life is pretty great. So, the lifestyle I think is really appealing. What is this lifestyle like? It is amazing. I have no idea where the call room is. I've run into very tired interns asking me where's the call room. I have no idea because I don't take call from the hospital. I'm on call. Let's see. This last year I was on call 0 days, but most pathologists are on call maybe a night. This will vary. My last job it was one night a month, 2 or 3 weekends a year, one holiday a year. Everything else is mine. I don't have to ask to take Christmas or Thanksgiving off. I have it off. When I did take call, I took call from my home in my pajamas and knock on wood, rarely ever got called in. And when I did, we just scanned it into a slide so I didn't have to leave my house. Hours, I think this is important for you guys to know. You should know what you're getting into. Academics, some is usually like maybe 8 to 5, Monday through Friday. Private's a little longer hours. They're pushing more slides, and some of them will work Saturdays. This is just general, but I think it's important to know what the lifestyle's like. Okay, what makes a good candidate in my specialty? I get this question a lot. Super generalizations. If your name is Christina, Chris, or Kristen, I'm just kidding. I'm just kidding. But it's true. I mean, so many people named Christina. And my name is Christina, by the way, if you forgot. Funky glasses. I'm not sure if you've noticed these spectacles, but you'll notice a lot of pathologists have funky glasses. Those are ridiculous answers. So let me just say this. My anecdotal experiences is a lot of pathologists thought about psychiatry, and I think that is because we love to think and we love to talk, and so that's a really nice fit. A lot of pathologists also did a or came from surgery. They really wanted to do surgery. They loved the high impact, the fast process, but they did not like the lifestyle. I remember. I don't know how he did it. I was with on call every third night in surgery, and the attending who was with me was 70 years old. I don't want to be 70 years old and taking 38 hours of call at a time. So, a lot of surgeons, a lot of psychiatrists. The main thing I think is intellectually curious people. I think that's common. So, what is my day like? I'm going to do this super fast because your next whole session is going to be about a day, but I just thought I'd tell you what my day is like. This would vary a lot depending on specialty. My day involves no autopsies ever. Let's go ahead and look at pictures. And this is not even true anymore. This is when I lived in Ohio. So, but usually I try to wake up around 7. I used to send my kids to school, of course, with COVID. They're in school in the house, which has been interesting. But yeah, I usually wake up around 7. I might start my day teaching, not in this capacity anymore. Now we teach on Zoom, but that's cool. I spend most of my day taking these slides and turning them into diagnoses. And I do that on Zoom, sign out with my trainees. I do present at tumor boards. It's all via Zoom now, but I'll present to university leadership, present at tumor boards. I love teaching medical students, so please keep in touch with me. This is, of course, before COVID, but this is our PSIG group. And let's see. This is reading frozen section slides. This we do still do in person. That's fun. We help the residents grow. So this is a resident grossing a uterus, and I'm just going in there helping her ink it and process it. And I usually try to leave every day between 4 and 6. My commute is about 15 minutes. So I'm usually home by 5 most days. And that gives me time to go for a walk, read a book, have dinner, watch a lot of TV. I love TV. And then I try to go to bed at 10. So that's my day. And that is the end of our whirlwind talk. Let's see, did I have anything else? Oh yeah, I wanted to just thank you again, Lauren and Dr. Mirza, for having me here. It's an honor to share the stage with Dr. Satar, the Pathomo. My gosh, I'm so excited. I hope this was helpful. And I am so happy to take any questions if you have any.
Well, thank you so much, Dr. Arnold. This was such a wonderful talk and really you gave such a lively and interactive look into the amazing field that pathology is. We have some questions popping in, and to our participants, please feel free to add more questions in the Q&A. You talked a little bit about you can do research and you don't have to do research. If you are really truly passionate about research, how does a career in pathology fit into that?
Right. So I think I love that question. Most of my answers are going to be whatever you want to do. There's a home for you in pathology. So if you were like Dr. Mirza has a PhD, my husband has a PhD. If you were a straight up hardcore researcher, you were going to do amazing things in pathology because there's not many of us who do that. So if you're used to writing papers for Cell and Science and Nature, I mean, you're going to just be a superstar in pathology, as Dr. Mirza and Dr. Mike Arnold are. So you can have that kind. So I say that's a research with a capital R. I always say I'm a research with a little r. So I'm not, my Beaker experience in graduate school is not prohibiting me from doing great things in my field. I like to do research based on the glass slides and patient care, and and I have an attention span that's about this big. So the papers I usually do over a couple of weeks, and they're not in Cell Site Nature, but they are directing how their field is moving, and so they're really rewarding. And if they're helping a patient who has unrecognized HIV get HIV testing, they're helping a patient get the care they need, then what more important work could I do? I definitely have friends who don't do any research, and I really want to emphasize that there's a place for everyone. So there's some of my friends who are diagnostic superstars. They spend all of their time really refining their eyes, and they're maybe interested in that alone, or they might be interested in training the next generation of doctors, and they maybe really pour themselves into education. So I think if you talk to pathologists, and this is really every doctor, you'll find everyone's passionate about something. And it's just about finding your home of where do you feel like you can give the most. This is okay. One other thing I have to say, I tell people in person, but I forgot this, is that find your people. So when you do your rotations in medical school, you'll see that everyone has their own vibe. The OB, the emergency medicine people to me always strike me as like the people you want to go have a beer with. They're just like so cool. And then there's the surgeons who are about to bust you up if you don't, they're very aggressive. And then you do this, everyone has their own vibe. And you want to feel like wherever you go, you're with your people. So you can feel like you can be yourself. If I had gone into surgery, I would have been like a nightmare because I'm not that personality type. And I would have always been feeling like I need to be somebody else. So yeah, so as you're checking fields out, guys, look at the personality types. Who is it easy to be around? Who can you be yourself?
Wonderful. And could you talk just about your experience with maybe your colleagues who are on other paths? So, like me, I'm really passionate about laboratory compliance, and that's going to be something that I'm going to do with my career. What other career, maybe odd, out of the box paths do you see in pathology?
I love that you're asking me this because I have a big secret. So, something that I've really gotten interested in, and I haven't really told anybody yet. I'm blushing already. I can see it. So this is going to be my debut announcement. Is that I'm becoming a certified life coach. So I'm taking a certification process. It's a year-long process, and it's to help people work through their career and personal challenges. Why I'm doing this, and I'm not the only one. Did you know Dr. Jen Hunt, who is chair of University of Florida, Gainesville, formerly of University of Arkansas Medical School, she is a certified coach. So I'm not a unicorn. There are several of us out there. And what I realize is that a big thread of my life is mentoring others. I love, 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 love that. I love helping other people. Love it. That is my thing. And I realized that I didn't have all the skills I needed. There's so much they will not teach you in medical school. There's just not enough time. And you just have to know these things. And so I'm working on building up my mentor skills so that when I work as I'm a former, no, well, former and formal mentor to faculty, residents, and medical students, I have more skills. So that's what I'm doing. That's my secret power that I'm working on. Other things, oh yes, being a lab hero, Lauren, that's amazing. We need you out there because that urban legend I said, there are a lot of people who don't even know what pathologists do. How sad is that? And if you don't know, what if you're at a school who doesn't know what a pathologist do? How are you ever going to pick this as a field? Or consider it as a field. So we need more lab heroes. The COVID crisis has revealed a lot of heroes, and I hope that when this is all done, people say it was the lab who made those diagnoses. It was the pathologists who turned around who brought on those tests, onboarded it, turned it around, so we could start opening schools and cities and countries and companies. That was done at the heels, at the shoulders, on the backs of pathologists. So drop that mic, girl. Drop it. Drop it. Yeah, so there's something for everyone. I think of all my friends, I could find other things um, that people are really interested in. I
Wonderful.
love that question. Thank you.
Well, that is actually a perfect segue into our next kind of pair of questions. What advice do you have for students who are thinking about pathology early in their med school careers? And what advice do you have on finding a mentor,
Hold on. I was
either
just
in
having this
pathology or in a specialty?
I have to say this. I have to say this. I have this little thread that just popped in my head, so I couldn't listen. I'm going to hear you again. Another thing that I think is really fun is social media. So I have to just put that out there. If you are a medical student in 2020, if you're thinking of becoming a medical, you have got to be on social media. You don't have to have an account, but I'm telling you, the content, the quality of education out there, you could meet, talk with a chair. You could meet some really important mentors and mentees. So that has become, I would never have guessed my phone would be a dominant part of my career, but it absolutely has. And what that means is everyone has a phone, right? There are no excuses not to be on there, and there's no excuses, to hold yourself back. I think you have to be careful in social media for sure. But if you just wanted to check it out, there's a lot of opportunities out there. So I think there's a lot of I think pathologists are doing social media the best in terms of educating each other and our patients and connecting. And yeah, and everyone has that gateway. We all have that ticket. Okay, now I'm all ears for you, Lauren. Tell me again.
All right. Well, it's still a perfect segue into these questions. So, what advice do you have for students who are thinking about pathology, maybe early or even late in their medical school career? And what advice do you have on finding a mentor?
Okay. So if you're thinking about pathology as a first year medical student, I applaud you because that's amazing. And that means you're at a place that has amazing pathology because I didn't think about it really to my third year of medical school. So you are so far ahead of the game if you're considering it. So let's say, because the advice is kind of tailored to what year you are. If you are a first year, think about getting involved in your pathology student interest group or whatever your center calls it. And if you don't have one, then think about making one. You could be the trailblazer. You can put it together. You can put it together with an army of people who are doing this on social media. So you could write Dr. Mirza, for example, you could write the virtual pathology, student interest group and tag on and say, hey, can you help me build a PSIG at my place? And that can be a key that opens a lot of doors as you approach to organize it. We're all here to help you, by the way, so you don't have to do it on your own. Yes, so that do that. And then let's see, I think when you're it's so hard with the blended curriculum these days. A lot of places have removed pathology from the formal curriculum and instead kind of blended it with everything else. And it makes it hard for students to see what is pathology, what are they doing. So the more you can get into the field, the better. Social media means you can do that even during the COVID pandemic, even during the lockdown. Pathollective.com allows you, and this is work by Dr. Cullen Lilly and Dr. Kamran Mirza, and you can take electives from your home from the quarantine. That's amazing all over the world. When the world starts opening up, and that's happening at our center, the medical students are starting to come back. I always encourage them, hey, if you're on your clinic and or you're in the OR and your surgeon says something, send something to the frozen section, go over and see if you can go look at that frozen section. Your surgeon will probably love it because you'll pressure the pathologist and you'll get that answer maybe a little faster. So see as much pathology as often as you can in as many ways as you can. Seeing it is great. The next step would be doing it. So that would be being a leader in your PSIG or creating a PSIG or creating events. The next level would be checking out what's out there for organizations. So ASCP, CAP, USCAP, those are our three main societies. They have space for medical students. And actually they have awards. So several of my mentees have won national awards through ASCP. It's a very straightforward application process. It's a huge honor. And yeah, there's a lot to be had out there in that space. What else? The last layer, if you can get involved in projects, you can help, build something to show like as a legacy. That's amazing. But most of us don't have that opportunity in medical students. But you guys are doing things I wasn't doing. So I think you can do anything. How do you find a mentor or a mentee? I think if you kind of follow that advice to see as much pathology as you can in as many ways as you can, you're going to naturally come across people. If you're on social media, for example, if you're at your PSIG, you're going to come across people who you just really love being around them. And those will be your mentors and mentees. Have more than one mentor. Have as many as you feel like you can, how much love you can put in your heart. Have as much as you can. I think for me, the best mentors are people who are happy and who make you happy. So you want to be around them because it's infectious. Like their joy and excitement is infectious. Those people make the best mentors. Every once in a while I get people saying, should I have a choice between someone super famous or someone who's just very available. I say, well, first of all, have them both. But if you had to choose, go with a person who will spend time with you, who you want to be like. Kind of that like find your vibe, find your field. It's the same advice. Find people who you love to be around. I love to be around Dr. Mirza. He's one of my favorite people in the world because he does so much and you just like if you just stand by him, you're going to go somewhere with him. So it's the same thing with mentors.
That's insane. So I wanted to say hi, Dr. Arnold. This has been such a great session, and I couldn't resist joining in. And I love how you described the vibe thing. I think there were some comments in the chat too. There's so many people like even if I just walk down the hall and if people are signing out, you can hear like cheerful conversations on people like around the scope talking about like pathology and patient care, etc. And that vibe is critical. And I love how you describe this. Do we go with someone famous versus someone who's available, and we can try both? I think it's the same for all the people who are in the match process. A lot of people ask me that question too. Like, do we go to a famous place for pathology, or do we go to a place that, may not be that famous, but where we'll get like really great mentorship? And that's a very tough question, because you could go to a really famous place and unfortunately not find the right mentorship, or you could go to a place where people are much more available to you. So ultimately, that vibe is so key. You've always inspired us, Dr. Arnold. It was a really, really great talk.
Oh, thank you. Oh my gosh, I'm so glad you said something. Can I build on what you had just said?
Of course.
I thought too, when I was a medical student, I thought that I love that the pathologists seem to be the best teachers. They seem to like be the happiest. I remember on call one night, I was going into I was on call, I was going to get a specimen from neurosurgery. I was picking it up and he said, "How come you guys are so happy?" And I was like, "Cause it's
Yeah,
pathology,
that's right.
That's like what it is." And then here's my advice. Here's my coaching advice for you guys. When you're out there and you're thinking, do I want to go to a famous place? Do I want to go to a place that will give me time? Everyone will make this own choice for themselves. And there's advantages for both. If you go to the top place, you are going to have a lot of opportunities, just like, I mean, both of them, you'll have a lot of opportunities. But I always chose happiness over anything else. I always chose, where am I going to be able to enjoy my family? Where am I going to be able to develop hobbies? Where am I going to be able to be this whole person? And I think if you make choices based on, I want to go to the best place, you're going to be funneled to those it'll be a pressure cooker residency that will lead to a pressure cooker job. If that's what you want, do it. They're
Right.
out there, but factor in your happiness.
People are literally giving you high fives in the chat. That's like
Oh,
that's how inspired they
love
are.
that.
It's
I
it's
love it.
100% true, right?
Back to you, friends. Back to
The
you.
places where you can become the best version of yourselves, there's nothing like it. Nothing like it.
Yes, yes. It's your life. It's a short one. How do you want to show up in your life? What do you want to leave behind you? And I love the question people were asking about job. What's a job field like? I love Dr. Sitar's answer. I had that question too as a medical student, and I agree with them 100%. Who cares what the job market is now? If you are good and you are passionate, you will find a job. I promise you. Good people who work hard will find a job. Do your passion. I think the worst thing you could do for yourself is pick a field based on a job market and it not align with who you are as a person. It will crush your soul. Pick what makes you happy. Always.
Absolutely.
I just have all the feels right now. Oh my God.
Okay, good. Good.
Any other closing thoughts before we transition to our next session? Thank you so much for
No.
joining us. Your energy and your passion is so infectious, and I can tell everyone is feeling it on the chat and on
Good.
Twitter, and this is
Thank
just
you.
so wonderful.
I am so happy to be here. I think the work that you guys are doing is really important. Lauren, you made this really easy. I love it. I love working with you guys. Anytime you need me, let me know. And all of you out there, all my friends out there, keep in touch. Good luck. I'm so proud of you. You're doing all the things. You are making history. And I'll see you next time.